Hello, I am Dr. Rajiv. Welcome to my education channel, Surgery and Orthopedic Education. Today, I have an orthopedic lesson for you, that is tibial IM nail removal instruments. Usually, five types of instruments are needed to remove a tibial IM nail. These are number one, hexagonal screwdrivers of different screw sizes like 4.8 millimeter, 4.5 millimeter and 3.5 millimeter. Second, sliding back hammer. Third, broken screw removal tools like a hollow mill, a T-handle and a special type of forceps. Nail extraction bolts are fourth instruments. These are either conical or rounded. And the fifth one is a tightening wrench. Tibial nails have holes for locking screws at the proximal and distal ends for better fixation stability post-operatively. The nails and the locking screws are available in different lengths and diameters. This is an expert tibial nailing system. After sterile prepping and draping, and with the knee in semi-flexed position, a bold incision of 4 to 5 cm is made vertically over the previous operative scar. The position of the upper end of the nail is located with the help of a fluoroscopic unit and is marked out. The patellar tendon is retracted laterally on the medial and lateral sides or as appropriate depending on the previous approach. The upper end of the nail is made fully visible by soft tissue clearance. If there is an end cap, the nail removal is a bit easier. First remove the end cap. If there is no end cap, the upper end hole in the nail is meticulously cleared of any soft tissue and ingrown bone. Now, the heads of all 4 or 5 locking screws are made visible through stab incisions. Remove all locking screws except one of the proximal or distal screws using the hexagonal screwdriver and the holding sleeve. One screw is not removed at this time to prevent rotation of the nail while applying the extraction bolt. Always remove the most proximal locking screw to facilitate the insertion of the extraction bolt into the proximal end of the nail. There are different types of nail engaging extraction bolts. Some are conical tipped and some are round tipped. Before removing the last locking screw, tighten firmly a well-fitting extraction bolt's distal end into the proximal end of the nail to prevent rotation of the nail or displacement of the nail posteriorly. Keep the knee flexed at more than 90 degrees all the time, otherwise the engaging bolt may impinge on or fracture the patella. A tight fit is achieved. Don't try to engage all the threads of the extraction bolt. Engage only up to a tight fit. This is a sliding back hammer. Now attach the distal end of the sliding back hammer assembly to the proximal end of the nail extraction bolt as shown in the picture. This is a full sliding hammer extraction bolt and tibial nail assembly. Now keeping the knee flexed more than 90 degrees, strike the sliding hammer back and forth. to disengage and extract the nail from the tibial medullary canal. Sometimes one or more locking screw break during unscrewing. A broken screw removal T-handle, a hollow mill, and a specially designed forceps are used in cases where either the screw head breaks apart or the screwdriver does not engage or slips within the screw head slot or the screw shaft breaks.